Hi, I am Lian Shara Cantre, and I'm going to discuss the adolescent health. So first, I will define what adolescent health is and what is the most important aspect of adolescent health, why is it need to focus on adolescent health, the mental health determinants, the common issue and common diseases of adolescents, and how can we prevent those diseases. So first, what is adolescent health? Adolescence is the phase of life between childhood and adulthood, from ages 10 to 19. It is a unique stage of human development and important time for laying the foundations of good health. Adolescents experience rapid physical, cognitive, and psychosocial growth. This affects how they think, how they make decisions, and how they interact with the world around them. What is the most important aspect of adolescent health? Adolescence is a critical link between childhood and adulthood, characterized by significant physical, psychological, and social transitions. So these transitions carry new risk but also present opportunities to positively influence the immediate and future health of young people, because this stage, the adolescent stage, is serve as the foundation of people's future. Despite being thought of as healthy stage of life, there is a significant death, illness, and injury in the adolescent years. Much of this is preventable or treatable, and some are not. During this phase, adolescents establish patterns of behavior, for instance, related to diet, physical activity, substance use, and sexual activity that can protect their health and the health of others around them, or put their health at risk now or in the future. Why is it need to focus on adolescent health? Adolescent period is a critical period for preventing chronic diseases. Adolescence is an important time for laying the foundations of good health in adulthood. Many health-related behaviors and conditions underlie the major non-communicable diseases start or reinforced during this period of life. So, there are mental health determinants. Adolescence is a crucial period for developing and maintaining social and emotional habits important for mental well-being. These include adopting healthy sleep patterns, taking regular exercise, developing coping and problem solving and interpersonal skills, and learning to manage emotions. Supportive environment in the family, at the school, and the wider community are also important for this adolescent stage. There are main common issue and common disease of adolescent. Those are unintentional injuries. Unintentional injuries are leading cause of death and disability among adolescents. Another is the violence, mental health, alcohol and drug use, tobacco use, HIV or AIDS, and another infectious disease, and the early pregnancy and childbirth. So let us discuss what are those common diseases and how can we prevent those common disease or main common issue of adolescents. Violence. Interpersonal violence is the fourth leading cause of death in adolescents and young people globally. Sexual violence also affects significant proportion of the youth. Violence during adolescence also increases the risk of injury, HIV, and other sexually transmitted infections, mental health problems, poor school performance, and dropout, early pregnancy, reproductive health problems, and communicable and non-communicable diseases. So prevention and violence. Effective prevention and response strategies include promoting parenting and early childhood development, addressing school-based bullying, prevention programs that develop life and social skills, and community approaches to reduce the access to alcohol and firearms. Mental health. Depression is one of the leading causes of illness and disability among adolescents, and suicide is the third leading cause of death in people aged 15 to 19 years. Many factors have an impact on the well-being and mental health of adolescents. Violence, poverty, stigma, exclusion, and living humanitarian and fragile settings can increase the risk of developing mental health problems. The consequences of not addressing adolescent mental health condition extend to adulthood. impairing both physical and mental health, and limiting opportunities to lead fulfilling lives as adults. Prevention and mental health. Building socio-emotional skills in children and adolescents and providing them with psychosocial support in schools and other community settings can help promote good mental health. Programs to help strengthen the ties between the adolescents and their families and improve quality of home environments are also important. If the problem arises, they should be detected and timely managed by competent and caring health workers.
Hi, I'm Alvin Kurt Castilla and I'm going to discuss about the common issue and common disease for adolescent and its prevention and health benefits for adolescents. Drinking alcohol among adolescents is a major concern in many countries. It can reduce self-control and increase risky behavior such as unsafe sex or dangerous driving. It is an underlying cause of injuries, violence, and premature deaths. It can also lead to health problems in later life and affects life expectancy. Alcohol and drug use is treatable. The treatment options, the one that's right for you, depends on your situation and your goals. Many people find that a combination of treatment works best and you can get them through a program. Some of these are inpatient or residential programs where you stay at a treatment center for a while. Others are outpatient programs where you live at home and go to the treatment center. So the prevention of alcohol and drug use are important areas of public health action and may include population-based strategies and interventions activities in school, community, family, and on the individual level, setting a minimum age for buying and consuming alcohol and eliminate marketing and advertising to minors are among the key strategies for reducing drinking among adolescents. Tobacco use. The vast majority of people using tobacco today began doing so when they were adolescents. Prohibiting the sale of tobacco products to minors under 18 years and increasing the price of tobacco products through higher taxes, banning tobacco advertising, and ensuring smoke-free environments are crucial. Globally, at least 1 in 10 adolescents aged 13 to 15 years uses tobacco, although there are areas where this figure is much higher. There are effective treatments that support tobacco cessation, including both behavioral therapies and FDA-approved medications. Smokers who receive a combination of behavioral treatment and cessation medications quit at higher rates than those who receive minimal intervention. Interventions such as brief advice from a healthcare worker, telephone, helplines, automated text messaging, and printed self-help materials can also facilitate smoke cessation. HIV and AIDS. Adolescents living with HIV have worse access to antiretroviral treatment, adherence to treatment, retention in care, and viral suppression, a key factor contributing to this limited provision of adolescent-friendly services, including psychosocial interventions and support. Human immunodeficiency virus is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. Other infectious diseases. Thanks to improved childhood vaccination, adolescent deaths and disability from measles have fallen markedly. For example, adolescents' mortality from measles fell by 90% in the African region between 2000 and 2012. Diarrhea and lower respiratory tract infection (RTI) occurs when there is an infection of the lungs, specifically in the lower airways. This infection is usually caused by a virus, but it can also caused by a bacteria or other less common organisms. And meningitis is an inflammation of fluid and membranes meninges surrounding your brain and spinal cord. The swelling from meningitis typically triggers signs and symptoms such as headache, fever, and stiff neck. There are many different types of HPV. Some types can cause health problems including genital warts and cancers, but there are vaccines that can stop these health problems from happening. With treatment, most people recover fully from infectious diseases. Some infectious diseases like HIV can't be cured yet, but with proper medical care, HIV can be controlled. Early pregnancy and childbirth. The leading cause of death for girls aged 15 to 19 years globally is complications from pregnancy and childbirth. Prevention. Adolescents need and have a right to comprehensive sexuality education, a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspect of sexuality. Better access to contraceptive information and services can reduce the number of girls becoming pregnant and giving birth at too young age. Laws that enforce that specify a minimum age of marriage at 18 can help. Nutrition and micronutrient deficiencies. Iron deficiency anemia was the second leading cause of years lost by adolescents to death and disability in 2016. Iron and folic acid supplements are a solution that also helps to promote health before adolescents become parents. Regular deworming in areas where intestinal helminths such as hookworm are common is recommended to prevent micronutrient including iron deficiencies. Four main strategies: dietary improvement including increased production and consumption of micronutrient-rich foods, food fortification, supplementation, and global public health and other disease control measures can be implemented to overcome micronutrient malnutrition. Prevention. Developing healthy eating habits in adolescents are foundations for good health in adulthood, reducing the marketing of foods high in saturated fats, trans fatty acids, free sugars, or salt, and providing access to healthy foods are important for all, but especially for children and adolescents. Physical activity provides fundamental health benefits for adolescents, including improved cardiorespiratory and muscular fitness, bone health maintenance for healthy body weight, and psychosocial benefits. To increase activity levels, countries, societies, and communities need to create safe and enabling environments and opportunities for physical activity for all adolescents. And physical activity helps to boost immune system and keeps the bone actively. More specifically, it is becoming increasingly clear that promoting and protecting adolescent health will lead to great public health, economic, and demographic benefits. Investments in adolescent health bring a triple dividend of health benefits. For adolescents now, promotion of positive behaviors and prevention, early detection and treatment of problems can immediately benefit adolescents. For adolescents' future lives, support for establishing healthy behaviors in adolescents will help set a pattern of healthy lifestyle and reduce morbidity, disability, and premature mortality later in adulthood. For the next generation, promotion of emotional well-being and healthy practices in adolescence and prevention of risk factors and burdens can help protect the health of future offspring. Thank you.